a little light on your personal COVID story, because from what I know, it was very bad, and
Yes.
I want to know how the pre-COVID Ravi Andrews was and the post-COVID Ravi Andrew is.
Yeah, unfortunately, I don't have my pictures about pre-COVID and post-COVID. But yes, I had a bad time during COVID. Now we're talking about COVID came into the world in December 2019. And India, I think early 2020, Feb or March. And at that point of time, we were still seeing patients. And Apollo Hospital was the only private hospital which was allowed to admit and treat COVID patients by the government. Otherwise, all the COVID patients had to, by force, go to Gandhi Hospital or one of the other government hospitals. And Gandhi was the one which was identified as treating COVID.
Yeah.
But there were corporate patients, private patients who wanted to go to private hospital.
Yes.
So Apollo was the only hospital which was allowed to treat COVID patients. So we continued to work through the COVID time. We were going there and seeing patients. Many a time patients come with COVID, but you don't know because you've not tested it. The testing turnaround was 24 hours. So the patient comes today, you do the test, and the next day you know that they have COVID.
Yeah.
In the meantime, you've already seen them and you've been exposed to them. So this happened to me. I was exposed to quite a lot of COVID patients without even realizing it. We took all the precautions, the mask and all the drama dressing and everything, all the war dress, everything we wore, but still a virus is a virus. It's going to come in somehow or the other. So I got it. This was in end of June.
2020 June.
June 2020. And at that time, nobody knew anything about COVID.
Yeah.
Nobody knew how to treat it.
It's just like brace yourself for the impact and let the tide
And
go.
yeah, just hope that you are one of the few who survive it. So, and there was no specific treatment. So I got sick. I tried to manage at home for a week. I stayed at home, suffering, fever, cough, cold, isolating myself from the rest of the family. But after 1 week, I started getting breathless. I started getting chest pain and breathlessness. So I knew that I couldn't
The
stay away.
breathlessness was when you were rested or when you were moving around?
Even at rest, I would feel breathless. I was checking my saturations. It started dropping after 1 week of the illness. And even at rest, I could not sleep. I couldn't lie down. I would be breathless. I would be coughing. So I said, no, enough was enough. I need to get to the hospital. So set off. And, because this was uncharted territory then, I didn't know that I was going to make it because there were so many horror stories of people dying of COVID.
Yes.
So I went to all the rooms in my house, just had a look at it and said, am I ever going to come back here again?
Okay.
Because, I was in that mode. Then while I was being taken to the hospital, I just looked back and, my whole family standing at the window looking out. I mean, it was a surreal moment. It was like crazy. So reached the hospital over there. My saturation level was some 70 or 80. At home, it was showing 92, 93. So, these pulse oximeters which they market, they're not really that good or accurate. So it was 70, 80 by the time I reached the hospital. Immediately put on oxygen, high flow oxygen. And at that time, my wife asked the ID specialist who was taking care of me, so what next? So he tells her, just pray. That was it. So she didn't tell me what he told her, but then, it just impacted her really badly. And I knew I was really sick because I'm usually so fit. I never ever have any problem, breathing difficulty, just lying down and not able to take a breath. Going to the bathroom was a big job because I would get breathless. And I thought I was not going to make it. That whole night I'm lying on my back and the lights, I'm not able to sleep, lights in front of my eyes. When you're driving sometime after a party and all, you're a little sloth and you lie down in the back of the car, somebody else is driving and you see the street lights going past you and you're all dizzy and you just don't know where you are, what's happening. That's the feeling I was having. Okay. And I had near-death experience. From a medical perspective, I've been very curious about these near-death experiences. There are situations where, a patient nearly dies and we pull him out of it. And then I've always asked them, what did you feel? What did you see? What happened when they get better, when you're almost near death? And they universally say that they're going towards a light. They're in a tunnel and they're going towards a light and they're trying to reach out for it. They're trying to reach that light. And then suddenly they're pulled back. They pull back and they open their eyes and they're here.
Okay.
I've asked at least 3 or 4 patients there and they've said that. I didn't have that kind of a near-death experience, but what happened was I'm lying down on my stomach because you're supposed to prone for better breathing, and I couldn't breathe properly. And suddenly one bull-like creature gets off my back. and this canters off. And you know what kind of bull? That bull you have in these
Villages.
not the villages, in these parks and all, amusement parks, no?
Yeah.
That rodeo bull, you're
Yeah,
supposed to
yeah.
get onto it and stay on it for some time.
Yeah, yeah.
So that kind of bull suddenly gets off my chest and canters off, and then suddenly I can breathe properly.
Okay.
That's my COVID bull. I got rid of the COVID bull. I mean, it was a weird experience, and always I've been on the other side of the table.
Yes.
This time I was on this side of the table, and I could really experience what a patient felt like.
Yeah.
So anyway, so the bull got off
And
me.
you were at the hospital for how many days?
I was in the hospital for a week.
For a week.
And the worst part was the second day after I was just getting better, and then my wife gets admitted because she also got COVID.
Oh no.
At that time, the only person who was at home was my daughter. She was writing a 10th standard exam. It was right there, 10th standard exam.
Okay.
So the first question I asked her is, what about Nakshatra? What's she going to do at home? She's all alone and you're here. So both of us were in the hospital for a
Who
week.
was taking care of her then?
She managed on
By
her own.
herself?
Yeah. We had a maid who we gave her an option. Either you go home
Or you stay with
or
us?
you stay for next 1 week till we come back. And she's very nice of her. So she stayed back and she took care of her. But yeah, so that was the more crazy and scary experience was our daughter all alone at home and we COVID lying down here. So that was
Maybe
scary.
that was one thing that kept you going, saying that you need to go back home for her.
Right from the beginning, that thing was there, that positive attitude was there, like I have to get back. I can't let this little virus beat me.
Yeah.
That was there. I mean, I never ever gave up, but there were certain times when you
feel
felt
like-
this is not in my control. What am I going to do? So that COVID experience, it changed me. It made me a little more understanding of other people's suffering, though as a medico, you're supposed to empathize
Yes.
and understand that and feel for them.
Yes.
But somewhere along the way, it slowly gets diluted because you see so
Obviously.
many people suffering. After some time,
Exactly.
it looks very similar. So yes, I learned more empathy. I learned the value of little things in life.
Yes.
Otherwise, you take things for granted. I learned the value of family and close friends, because I know this sounds unscientific, but I think the only reason I survived was because of the good wishes of all the people that I had treated and who I had taken care of and who wanted me to
Yes.
get well. I think that's the reason, sole reason. It's not medicine, it's not luck, it's nothing. It's just good wishes. And I think that's what our focus should be. Be the best possible person that you can be, the best possible version of yourself that you can be.
Yeah.
And everything will fall into place.
So, how much about your perspective when you send off patients now home after treating them from a very bad phase,
Yes.
compared to before you got COVID and now? How much that has changed? The kind of emotion and feeling that you let go of that patient to go back home, how much has that changed?
Now, I'll answer this question in a different way.
Yeah.
I've always been asked, what is the most satisfying moment as a doctor? And 99% doctors will tell you, a really critically ill patient was admitted. He was sick. He was dying. We did whatever we could do. We treated him. We saved him. And he walked out of the hospital thanking us.
Yes.
That is real job satisfaction. 99% doctors will tell you this. I'm going to differ a little bit there. And I learned this after 15 years of practice of medicine. I did not learn this in the beginning. In the beginning, for the first 5 to 10 years, I was thinking, patient comes very sick, almost dying. You treat them, they respond to your treatment, they get better, they walk out, they say thank you, and they walk out, and they come back after 2 months to your OPD, and you feel so happy. You feel so satisfied. Over the years, I realized there's the two aspects to satisfaction: personal satisfaction and professional satisfaction.
True.
When a patient gets well and goes away, gets better, comes back again for follow-up, you definitely get a personal satisfaction. You also get a professional satisfaction. And many a time we mix these two up.
Yeah.
For me, the real professional satisfaction is patient comes really sick. You do all the best, you do the very best that you can do, and the patient dies. And then the family tells you, thank you very much for all that you've done. You've done the best that you could do, and I know he didn't make it or she didn't make it, but thank you for all the efforts that you put. That is professional satisfaction. Because nowadays it's always blame the doctor, right? If
Yes.
something goes wrong, the doctor gave a wrong medicine, the hospital didn't treat properly, the nurses didn't take care properly. It's always the blame game. But when things don't go well and then they appreciate it, that is professional satisfaction. And that's what I have learned now. Now there are two aspects to satisfaction: job satisfaction, personal. If they get well, obviously anybody would be happy.
Yes.
And you're really happy. And professional satisfaction, they don't get well, they don't make it, and still people appreciate all the effort that you put.
Sense.
So post-COVID, I don't think much has changed there. Still, this personal satisfaction and professional satisfaction still remains the same.